With that, if I would like to recognize the ranking member of the subcommittee, Congressman Cole, for any opening remarks.
Well, thank you very much, Madam Chair. And before I begin my scripted remarks, I want to welcome our friend and our former colleague to this position. And I couldn't be more pleased, other than, of course, had there been a Republican secretary. But that aside, the secretary and I, Madam Chair, had the good fortune of serving together with our late colleague, Sam Johnson, for many years on the Smithsonian board. And as everybody on this panel knows on both sides of the aisle, he's a person of unquestioned ability, a person of genuine integrity and decency. And while he certainly holds strong views, which I respect, some of which I agree with, some of which he knows I do not. When you serve together, you sort of know where everybody stands. But he's also got a practicing politician's fine sense of the possible. He was a great legislator when he was here. And so I can tell you, just from my experience on this committee, Mr. Secretary, whether it was under Democratic or Republican majorities, or whether it were Democratic or Republican secretaries, this committee's historically been very supportive of whoever the Secretary of HHS is. We know, as the chairwoman indicated, how vast your responsibilities are and how important they are to the American people. And I don't know if we could do this time. Probably not, because I think your budget request is an ambitious budget request, which I applaud, quite frankly. But we've given secretaries of the last two administrations more money than they asked for, because we thought they had more problems maybe than they understood coming into these jobs. And again, as our chairwoman indicated, you're coming in at a challenging time. So I just want you to know up front, we recognize that. We recognize that we know there will be areas we differ. I'll mention some of those in my formal remarks. But I also know you're somebody we can work with and somebody that understands how we work. So I'm very delighted that the president made the decision to choose you, and why you made the decision to leave a wonderful position in California and come back here. You'll have to explain that to us over a drink sometime, but it is good to have you back. So with that, Mr. Secretary, I want to welcome you to your first hearing of our subcommittee. I look forward to our hearing with you today and hope that we can meet in person at the next one. The Department of Health and Human Services has broad responsibility covering almost every aspect of daily life. This is indeed a monumental responsibility that's been brought to light for everyone to see over the past year. I want to start by acknowledging the hard work and unwavering commitment of the employees of the Health and Human Services Department. Against nearly insurmountable odds, this agency has faced a global pandemic, and just over 1 year later, efforts of your agency have left our nation well on the way to having every willing adult vaccinated. Yet another truly remarkable achievement for the United States. Despite the many challenges of the past year, I was proud to see Congress come together 5 times to pass emergency supplemental appropriations to help us through the pandemic. Our work together enabled us to create funding packages that everyone could be proud of. I'm therefore disappointed that the majority's chosen thus far to abandon this bipartisan course in favor of the pursuit of a partisan budget proposal, complete with lengthy liberal wish lists, replete with items totally unrelated to the pandemic or public health. The president pledged an administration of unity, but sadly it's begun with a legislative strategy of division. I certainly hope we can expect a return to an appropriations process that recognizes the role of bipartisanship, and I look forward to the release of the complete budget materials next month. Your agency oversees health care for our seniors and Native Americans and provides the foundation for core investments in public health and emergency preparedness. The National Institute of Health and provides the critical basic research leading to biomedical innovations, spawning new therapies, treatment, and medications for countless diseases. The social supports under your purview enables those seeking mental health or substance abuse treatment to have qualified evidence-based options available. The budget you put before us seeks to address numerous challenges: an opioid addiction epidemic, concerning levels of maternal mortality, a humanitarian crisis at the southern border, and a clear need to prepare for the next pandemic. However, I disagree with the approach taken in the administration's overall budget request. To put it simply, it spends far too much on domestic programs, far too little on defense. With China and Russia building up their militaries and becoming increasingly more aggressive, America cannot afford to stand still or cut back on defense spending. At a minimum, we need to see a 3 to 5% annual increase beyond the rate of inflation for defense spending over the next several years. That may require some adjustments in domestic spending requests. Looking at the domestic program, several of which are in this subcommittee, the budget proposal, like the most recent coronavirus relief package and infrastructure proposal, simply spends more than our nation can afford. Moreover, much of the spending is not necessary. Our economic recovery is well underway, and many of the proposed program increases, while well-intentioned, are not warranted on the scale requested. I do agree with the president that we need to invest more in the areas of public health and biomedical research. Indeed, in recent years, this subcommittee has spent more than either of the last two administrations requested in these areas. And I think the current pandemic has demonstrated the wisdom of that investment. To keep America safe and healthy, the United States needs to continue to increase funding for the National Institutes of Health, the Center for Disease Control and Prevention, and other related programs. And I note that you certainly made those proposals, Mr. Secretary, in your budget. We now have faced a pandemic in our lifetime. Let's use this lesson to leave future generations better prepared to address the next one. I firmly believe our investments in NIH over the past several years, made us better positioned to address the challenges of coronavirus. We cannot let that commitment to sustained increases waver. Like our national security, American leadership in biomedical research cannot be compromised. I was disappointed to see no mention of the Biomedical Advanced Research Development Authority, or BARDA, in the budget released last week, but I would expect perhaps to see that when we see a fuller budget. The success of Operation Warp Speed to develop, produce, and distribute multiple safe, highly effective vaccine candidates in less than a year is unprecedented in medical history. Now more than at any other time, we need to ensure BARDA continues its key role in countermeasure development. Our country needs to be ready to respond to any event to protect the health of the nation. In closing, I just want to mention one other important issue as it relates to this bill and your agency. For more than 4 decades, across multiple administrations and Congresses, led by both Democrats and Republicans, language has been included in the Labor, Health, and Human Services Appropriation Bill that restricts federal taxpayer funding for abortion under most circumstances. This provision reflects a time-tested balance of strongly held and differing perspectives on abortion in this country. Our bills have been able to advance year after year with bipartisan support with this balance in place. As such, I will strongly oppose any appropriations bill that seeks to weaken pro-life protections or eliminates Hyde policies. And I expect that under your leadership, HHS will continue to enforce those provisions of existing law. I look forward to our discussion today, and I thank you for coming before us. Again, it's a genuine pleasure to have you back, and I think a good choice by the President of the United States to persuade you to come and serve again. So welcome, and look forward to hearing your remarks.